Hello, and welcome to this presentation, Social Justice Mental Health Warriors and the Psychobiosocial Model of Care. I'm Dr. Elaine Levine, and I will be talking with you about my cases working in a border town between the United States and Mexico, and how that can demonstrate the concept of being social justice warriors. I have with me Dr. Elaine Foster, who will be offering some comments on each of these cases and helping us understand a little bit more about how this model fits into our bigger goals for this program. Dr. Foster?
Thank you, Dr. Levine. I look forward to this presentation because it really travels to the heart of what we're trying to do, reaching the underserved and areas where there are shortages of prescribers, mental health prescribers.
Yes. Okay, well, let's get started. Let me begin by discussing with you what is a social justice orientation. In actuality, this is not a new idea. It's been around since the time of Socrates and has been reformulated by philosophers that we admire, such as Thomas Aquinas and Spinoza, and in the United States, Thomas Paine. And the concept of the social justice orientation is that we, as social service workers, need to work to reduce the barriers to change among the underserved and disenfranchised populations. A rather classic example is the difference between offering food to underserved populations versus teaching the population how to grow food for themselves. Recently, you may have heard in the news another social justice orientation, that of teaching people in underserved areas where there isn't electricity how to make solar power. And by teaching some people these skills, they are providing jobs, and at the same time, that jobs lead to light in the community for everybody. Now, providing education, you can see, as well as good care, physical and mental health care, is very important in a social justice orientation. And the concept of social justice warriors has evolved more recently to refer to people that understand that providing for the well-being of individuals physically and psychologically, with an underpinning of teaching them skills that they need to improve their lives, is critical in a social justice orientation. Classic social justice warriors are Martin Luther King in our country. In India, where a number of our students are participating in this program, a classic warrior is Gandhi. As I'm sure our Indian participants know better than I, Gandhi understood the importance of the Indian people taking their skills back rather than exporting their raw resources to the British Empire, but taking their skills back in creating textiles and taking care of their own people as part of a way of improving the lot of the poor and the underserved. Now, in this presentation, I hope to show you some of my work in a border community between the United States and New Mexico. I think for many of you working with underserved populations, you will see quite a similarity between this population and those that you work with. I'd like to tell you about this community on the border of New Mexico and Mexico. The community is called BERINO. And in order to understand a little bit more about it, let me just share a bit of the history between the United States and Mexico along the border. Over the several hundred years since the United States has been incorporated and separated from Mexico, there has been quite a lot of movement across the border. And whenever there has been a shortage of labor in the United States, such as during World War I, World War II, the border tends to open up, and many poor people from Mexico come in to work in labor jobs that are not being filled. These programs have been referred to as the bracero programs. Then in times of plenty, when the jobs, there are not so many jobs for poor people, the border tends to close up and there's much stricter immigration laws. Well, for communities like ours in New Mexico or Texas or Arizona that border Mexico, the movement back and forth across the border continues to be pretty free, although sometimes it's very secretive. And what happens is that you have populations in the United States where members of a family are US citizens and other members of the family are still citizens from Mexico. Now, recently, some events have increased the attempts of poor Mexicans to come across the border. You may have heard that the violence in Juarez, Mexico, which borders El Paso, Texas, has been some of the worst in the world because of drug cartels. So many people try to escape the poverty and the violence of these border towns, such as Juarez. But coming across is probably more dangerous than it ever has been. There are people that offer to take these poor Mexicans across the border, but their real intent is to take the little money that these people have. Often they let them off in areas that are very dangerous to pass, and the death of many of these people seeking a better life across the border has increased tremendously. Some people make it across, and they may come across with several children, and then they have more children in the United States. This creates quite a dilemma because the children that are born in the United States are natural citizens. But the children that came across from Mexico are here illegally. So you have families that are hiding out with some of their family members, American citizens, and others that are fearful to even show their face publicly. Now, what often happens in these situations in populations like BERINO, where the families are comprised of a mixture of citizens and American citizens and Mexican citizens, is that there's very limited mental health care. And too often, there is a use of medications to try to solve all sorts of problems that are really related to poverty issues, to lack of access to stimulation, to poor behavioral controls in families that are at subsistence level, and parents are really not around and available to supervise the children. There have been a lot of studies in our country that in these communities, there tends to be an overprescription of psychotropic medications. And what is happening in a large extent is that these children, particularly the children, but even adults sometimes, are being sedated by medication rather than really being helped to resolve their problems. Let me tell you a little bit about BERINO. This is a small community. The city itself is only 860 residents. But if you consider the farming areas nearby, there are about 11,000 people there that have been documented. And only about half of the people that live in BERINO have above an 8th grade education. Most are really living beneath the poverty level in our country, so that at least a third of the families are making less than $10,000 a year. Many of the families that I worked with in BERINO lived in trailers where maybe there were 15 people living in a 3-room trailer. Oftentimes, they didn't even have complete roofs. I remember a story from one of the social workers that I was working with, that she was talking with a father and a child in one of these trailers, and this giant tarantula spider fell down through the ceiling right in front of them. That would kind of impede your developing a therapeutic relationship. There are no books in these homes or toys for the children. And most people don't have cars. But interestingly, almost all of these trailers have TVs, and the children do have video games that they can play on the TVs. So this creates something that anthropologists have talked about in border towns as a cargo cult, that people there don't have access to the riches of the society that they're abutting, but they know all about it. They understand and they know about a better way of life. I thought I'd show you a couple photos from BERINO because I think it's probably very similar to what you face in some of your underserved communities. I liked this photo because you can see how a house here that had about 5 families living in it is right next to an industrial area, and what that must be like in terms of noise or just quality of life for the children. Here's another photo just to give you more of an impression. There were about 20 people living in these 3 different buildings. The reason I wanted to include this photograph is because this is downtown BERINO. And when I worked with the adolescents, and I would ask them, well, what do you do on the weekends for fun? They would tell me they would go downtown. Here's the other end of downtown. I really want to stress this because these people had so much spirit, and it's very easy to kind of look down upon these people and feel sorry for them. But that is not a helpful orientation. And it's pretty easy to not understand where they're really coming from. I know because that happened to me, even though I thought I was pretty sensitive to cross-cultural issues and issues of the underserved. Just to give you an example, we were talking about a child whose behavior was totally out of control. And I made a comment that if there were some toys in the house, or maybe some books, something to stimulate this child, maybe she wouldn't be so obstreperous. Well, the social worker at the time said to me, Dr. Levine, I don't think you quite understand. If this family has any money, what they will do is save it to go to the McDonald's on the edge of El Paso on Sunday. Because if you can hitch a ride to the McDonald's on Sunday morning, you dress all up and your kids get to play with the equipment there, and they maybe get a toy in their Happy Meal. And that means you've really arrived. And I was pretty shamed by this recognition of their own way of fighting for a better life and trying to understand it from their perspective. And many of them would say to me, you know, our life is better than it was in Mexico. It's better than before. And I came to understand on a much deeper level what it means when we say that these poor and underserved populations have a present orientation. Much of what they see on their TV or what they're told in school doesn't even seem realistic for them, but they do find a way to be happy in the moment. Now, my role at PASOS Adelante in BERINO, New Mexico, was as the only doctoral level clinician and the medication manager for everybody that came in. This was such a wonderful little facility that adopted a psychobiosocial model of care. When they first asked me to come there, I said to the director, I don't think I'm the person that you want, because I think we should be taking these kids off of most of these medications. And he said, yes, that's exactly what we want. Then I said, well, there's a big hitch. I am not fluent in Spanish. And he said, we'll have a translator for you. You're just who we want. Then I said, well, there's no way I would consider medicating these children and not being part of the team. And said, well, what would you need? And they said, well, whoever's treating the kids, the social worker, the counselor, the master's level psychologist, I want them in on all the sessions that I have, and I want them to explain to me what they're doing with the patients, and I want to be able to meet with them so that we work together to plan the procedure. So, Dr. Foster, before I go on with some of my specific cases, you and I have talked in our introductory lecture on the psychobiosocial model a bit about task shifting. And I'm wondering if you could speak on how that fits in with the kind of work that I began doing in BERINO.
I think that it seems to work very nicely. The World Health Organization has promoted the idea of task shifting, which is very much like your social justice warriors, because the idea behind it is because we have such a shortage of mental health providers, psychiatrists being one of the most unavailable, there has to be some taking up of the slack by other providers who can see these patients and have more one-on-one interaction with them. And what we're trying to do through this model of promoting the psychobiosocial approach to treatment is to enhance the skill set of the people who are on the front lines with these underserved populations. And that's why I'm so fascinated to hear what you're describing, because this is very much right there in the trenches, the work that you are doing with this population.
Okay, well, let me tell you some more. So here's some examples of some cases from BERINO and the little community clinic called PASOS ADELANTE. Let me tell you about Jorge, who just wanted his father. This was a 10-year-old. He was born in the United States, and he was living with his mother, who had crossed the border illegally. They had Medicaid because in the United States, all children, if they're born in the United States or not, can receive Medicaid, that's insurance for the poor, under a program that's called TANF. That's TANFF is the acronym for it. Well, this young boy had stolen a Game Boy from a neighbor, and he was picked up by the police and put in the nearby mental hospital for, quote, evaluation. He only 10 years old, and he was released a week later with the diagnosis of bipolar disorder and placed on 500 milligrams of divalproic acid daily. Now, when you study about bipolar disorder, you'll learn more about how this medication, also called Depakote, is often used, but that it has a very intense side effect profile. So it's not a medication you should consider using lightly. As I began to learn more about this youngster, and also from the master's level psychologist that was talking with us in our sessions, he'd been a perfectly behaved little boy till about age 7. The records from kindergarten indicated he was a model student, bright-eyed, respectful. And then when he was in first grade, his father, who was a Mexican national, was arrested for the 3rd time and put in prison. In our country, there has been a policy that the first several times a national is caught, they send him back over the border. The 3rd time, they put him in prison for 18 months. Very quickly after that incident, this young boy became extremely oppositional. He refused to do his work at school. He became difficult to manage. And recently, his father had been released from prison, but put back in Mexico. And because of all the violence there, the mother was afraid to travel to Juarez. So he hadn't seen his father for about 2 years. First of all, we tried to provide supportive therapy to this little youngster about all his anger and his confusion. He didn't see his father as a bad person. He didn't understand why he was in prison, and he certainly didn't understand why he couldn't go see him now, especially that he knew his father was out of prison. One of the first things that I did was to reduce and stop the Depakote, the divalproic acid. This is a good indication of what we say: the right to prescribe is the right to unprescribe. And we worked a lot with the mother, who really was trying so hard just to survive, really hadn't stopped to consider how traumatic the loss of the father was to this little boy. We also, in time, were able to set up some visitations with his father at a safe place in between right on the border. And we used that as a reinforcer for his good behavior at school. It was amazing how quickly his behavior began to stabilize as he felt listened to and as his mother understood better how to support him. We had a lot of catching up to do. It was necessary to find a tutor for him because he had just blocked out the last couple years of school. But by the time he'd been at PASOS ADELANTE for about 3 months, we felt we had been some social justice warriors that were getting this young, sweet boy back on track in life. Dr. Foster, do you have some thoughts about this case?
I love what you did with this idea of the power to prescribe being the power to unprescribe, because here you have something that breaks probably anybody's heart to hear the story of a little boy who loses his father to prison and then is given this chemical straitjacket, is the best way I can put it, to use a medicine to not only calm him down, but to cover his grief. And the idea that you could take the time and work with the people who are the allied professionals to make such a incredible difference with no medicine, I think really speaks to the magic of this approach and caring.
Thank you. And that reminds me, being a social justice warrior is not easy. And I struggled so much around my limited use of Spanish. And the master's level people working day by day with this population were all fluent in English and Spanish. And they would be the translators.
Mm-hmm.
I understood enough Spanish to know sometimes if they weren't translating it the way I meant it to be. But something else happened, and it happened with this mother. I was working so hard to have that relationship with her and the little boy that I couldn't hold myself back, and I'd start speaking in my broken Spanish to these patients. And they would look at me in disbelief because they didn't know what I was saying. But fortunately, the therapists that were bilingual, they would translate my broken Spanish into meaningful Spanish for them. I could hear them saying what Dr. Levine means to say is. So we stumbled through, but I think the fact that they knew that I was really on their side and that I really wanted their life to be better made all the difference, from taking that kind of top-down medical position where I know what's wrong with you, I'm going to give you the medication, and that's that. I'll see you in 2 months. Well, let me tell you about Juanita. I call this one, my case, La Llorona plus PTSD. Now, there's a story, a myth, very common in border towns about La Llorona, which means the weeping woman. And the myth is told differently by different people. But the essence of the story is that this woman is desperately in love with a man, and she already has 4 children, and he doesn't want to have anything to do with her. And she thinks if she got rid of the children, he might love her. And so she drowns her children, if you can imagine. and he still spurns her. And she desperately follows him, and he has nothing to do with her. And she ends up taking her own life. And when she comes to heaven, she is told that she can't enter until she finds her children, makes uh, amends, and discovers her children. So she's sent back to Earth, and she wanders along the ocean front, crying every night, looking for her children. And oftentimes, it's kind of one of those scary fairy tales. I understand that the story is told to little kids that don't you go out by night by yourself, because, La Lorana may come find you and think you're one of her children. So that's the story that I thought of when I met this woman, 21 years old, an American citizen. She was 6 months pregnant. She had 4 children, but also living in that home were all sorts of relatives that came and went. Now, the father of all 4 children was a Mexican citizen. He owned a shop in Juarez, Mexico. And he was a victim of this drug cartel violence. She and her significant other were in a drive-in. I can't call it a restaurant, because in Juarez they have bars that you can drive up to, and they'll bring the alcohol to the car. So they were in one of these drive-in bars, and they were attacked by the drug cartel. And the man tried to drive the car away. Both he and my patient, Juanita, were shot. She had a number of bullets hit her in the leg. And he, though he managed to drive a few blocks away, was really blown to pieces. And so he died in front of her. Now, whether he was in the cartel, I don't really know. She said that he just refused to cooperate with them. But she also let me know that the cartel was still after her. So the situation was really awful. She had terrible PTSD, flashbacks every night about being shot. And she mourned for him, unbelievable mourning for this man. She had started drinking alcohol even though she was pregnant. And to make matters worse, she would sneak across the border at night and lie on his grave. Well, obviously, she needed some supportive counseling. And I was also able to do some EMDR. I don't know, I think many of you are probably familiar with that technique. And it did seem to help her a lot with her nightmares. She was beginning to drink quite a lot. She cried all the time. So I was in contact with her obstetrician, and despite the fact that there are some risks to medication when you're pregnant, we decided it was better for her to be on an antidepressant than to be drinking. And we agreed to fluoxetine, which we raised to 40 milligrams, which seemed to be somewhat helpful to her. Now, it was very important to talk to her about the effects of the medication, and that, it would be better if she could actually function without the alcohol and without any medication since she was pregnant. And that became a really major theme of the therapy with her, is she was grieving so deeply, but trying to get her to stay alive and do the right thing for her children and for the baby that she was carrying. And that included not going across the border and lying on the grave and weeping at night, knowing that the drug cartel was after her. Well, the combination of supportive therapy, really emphasizing the well-being of her children, medication, but also helping her see a way out of the life that she had always had, really made a difference. The staff worked with her so that she could get the equivalent of a high school degree, and they also worked with her to get benefits, to get into her own apartment with her children, to get away from this constant influx of people that she was living with that was just overwhelming in numbers. She was still, at the end of 3 months, still grieving her husband, but was much more hopeful. She did deliver a healthy baby, which was a relief to all of us, and was beginning to see a future life for herself. So, Dr. Foster, do you have any thoughts about this case that you might share?
Again, another fascinating case. I like the fable of La Llorona, which is how we would say it with the Hispanic
right
accent. But just two quick things. One is I see why you had to use the higher dose of fluoxetine. One being because we know that metabolism speeds up during pregnancy, so she's going to eliminate that drug faster. So something to keep in mind, which we'll talk about in another lecture. But the other thing is with PTSD, having worked with a military population, I can tell you that they normally do require the higher doses. Even more significantly, though, is that you added a type of exposure therapy, which is, again, one of the most important things to do with an integrative approach and to be able to probably have achieved the outcome you did, which was her being hopeful again about the future and delivering a healthy baby.
And I must say, too, in listening to what you're saying, the hope came a lot from the fact that the workers there, the mental health workers, are social justice warriors, and they were determined to help her find a way to have a better life. Here's a rather different case. This is about Victor. He had a lot of medical issues, and as these slides explain, up to the present, when he came to PASOS ADELANTE, everybody considered any kind of misbehavior he had as part of his medical issues. He suffered from severe grand mal epilepsy, and he had seizures and extreme anger outbursts. He was on a number of seizure medications and still only had moderate control over his seizures and his behavior. Now, when I was able to meet with Victor, he's disclosed some information that he apparently had not told anybody. The staff had told me that they learned that his mother was a drug addict and committed suicide. But what he told me was that he had known his father was having an affair with a woman. And once, when he was working with his father would repair roofs. He was up on the roof and he somehow looked around and saw his father having sex with this woman he was having an affair with. And Victor went home and told his mother about it. And the relationship between the mother and father blew up. And so when his mother committed suicide, he felt totally responsible. that this was his fault because of what he had disclosed. To make matters worse, the father was living with the woman that he had an affair with, and Victor just couldn't tolerate that. I was concerned about the anger outbursts and tried to make that a central focus when we first began therapy. And interestingly, in this case, something about the quiet time that he had with me allowed him to disclose information that he hadn't previously disclosed to the psychologist and the social worker that were working more from this social action, social warrior approach. So once he revealed this information about his guilt, regarding his mother, we certainly knew that that was important to approach. And we also let his father know how angry he was at him for that affair and feeling that his father, as well as he himself, had caused this, his mother's suicide, and how he couldn't tolerate the mother's girlfriend. But that became a complication because there was no way that the father was going to separate from this woman. I worked with the family care doctor. At this point, I wasn't able to get a hold of the neurologist, but we did decide that maybe a little bit of Risperdal might help him manage the anger on top of the very intense therapy that we were doing with him. And we had some pretty good results. He was able to stay at school without these violent outbursts for a considerable amount of time. I want to add about this case that we did have one incident where he really blew up at school, and it turned out that he had seen a neurologist in the meantime, the one that I wasn't able to get a hold of. And this neurologist had changed all his medication around and taken him off the Risperdal. And he had a terrible explosion at school. So finally, I was able to get a hold of the neurologist, and we worked together from then on and got better control over his behavior. But I wanted to be sure and mention this factor because this is often what happens in communities where populations are so underserved, is there's not good communication between the various health professionals, and many problems are created because of that. And your thoughts, Dr. Foster?
I agree. I think even within hospitals where I've often worked, there's difficulty communicating. The notes are sitting right there on the computer to be reviewed by the physician, but many times they're just so busy that they don't take the time to look at what you've prescribed and decide they're going to go with their own medley. But what I think is very interesting about this case, once again, is that the real work was understanding what was driving this boy's behavior and being able to see how incredible that grief must have been for him to have told his mother and then have her commit suicide. I could very well see how it would have been easy to do another chemical straitjacket here
Right.
with the violence and outbursts, but to take the time and to get to the core of what was driving that behavior, in my mind, is so important because that's going to last him for the rest of his life, not just the lifetime of a particular prescription.
Right. And so much, everything was considered due to his seizure disorder
Mm.
and add more seizure medicine. So it was really important in this case. Well, finally, let me tell you about Ernesto and his broken heart. This was an 18-year-old who had been sent to the hospital because of a suicide attempt. He had uh, gotten his mother's medication and taken all sorts of things. He'd recently broken up with a girlfriend, and that seemed to be the immediate trigger. In the hospital, where he stayed for just a few days, they placed him on fluoxetine and diagnosed him as depressed, and trazodone for sleep. Now, what was really remarkable to me when he came to see me with his mother is that neither the patient nor the mother had been informed anything about these medications. No one had told them about the suicidal warning in using fluoxetine, particularly with adolescents. No one had told him about the side effects of trazodone, which could be very relevant and probably embarrassed for him to even talk about. So, being able to discuss that with them was very important. And when we looked at more of what was going on in his life, yes, he broke up with the girlfriend, but there was much more of concern. His mother had a new man in their lives, and Ernesto was the oldest of a number of children, and he didn't like this man. This man was abusive, verbally to the kids and to his mother. The mother didn't really like him either. She was just relying upon him because he had a part-time job. And Ernesto was furious about all that. And in the meantime, the mother was putting tremendous pressure on Ernesto to get a job and bring money to support the family, because that way she could get rid of this other man that was bringing in money. Well, getting a job in BERINO is not an easy thing to do. There aren't very many jobs. And Ernesto tried. He even came to PASOS ADELANTE and wanted to know if they would pay him for sweeping. So he was very trapped in his life space. The therapy here certainly involved helping him develop a way out of this entrapment. Again, we worked on his getting the equivalent of a high school degree, and the staff worked to get him into a wonderful program in El Paso, where it's a live-in program for about 6 months, where they train him, these young men and women, in some basic work skills. Now, one of the real challenges in this case was that the mother wasn't ready to let him go. She really wanted him to take over responsibility for the family. And we have to put this in context, what these families go through, and not be overly critical, but try to be understanding and help the mother find some other way to resolve her problems too. So that became a really important part of the work, is working with the mother to let him go, to help her see that she had some skills where she could get a job and she didn't have to depend upon this abusive individual, but also to help her see that if she would let her son go, and if he could be more successful in a way that she couldn't even imagine, that he could be more helpful to her and the family. This was a great success story. I don't really think he even could be considered really depressed as much as trapped by his circumstances. And with this kind of help, he too was able to stop all the medication and to thrive. So, do you have some thoughts for us, Dr. Foster?
The only thought I would add to that is the benefit of adding family members in this particular treatment, and of course, really on a case-by-case basis, because you could have done all that work with him, and if mother was still lagging behind or having some significant problems, you may not have seen the kind of benefit that you did. So this holistic approach to treating not only the patient but the family members, I think, is dramatic.
Good. So, in summary, let's talk about using the psychobiosocial approach with the underserved. It's an approach that's systems oriented, that presumes there's a continuum between function and dysfunction, and that we can move people to a healthy state. We look at people's strengths and move towards their strengths, and always focus on the very complex but unique nature of each patient. And when we adopt this psychobiosocial way of approaching mental health, we do become, all of us, social justice warriors. Dr. Foster?
The only thing that I would add is the importance of that one statement: the power to prescribe is the power to unprescribe. And what I see here in your cases over and over again is that you've not just pulled out the prescription pad and written a quick script to get them out of the office. You have sought to understand the system that they're coming from, the culture that they're living in, and even the biculturality, because the idea of seeing something on television that you can't have and seems so remote is going to have an impact on your psychosocial development. So I think that the fact that you have used the allied professionals in the way that you did to help as a team to build up each one of these patients, again, speaks to the model that we're trying to promote globally. This idea that people who care and who are specialized in the field of psychosocial approaches, with this extra training to help them understand how medicines fit in, can make such an incredible impact on the lives of people who are currently underserved.
Thank you, Dr. Foster. And thank all of you for participating in this program with us.